So just to mention again, for those who, hang on, let me change. Okay. All right, so just to mention for those who just joined, we will be recording the session today, and we will share this out for everybody to share as needed with your teams, and so that you can review this on an ongoing basis as you need to. All right. So welcome everybody to our second new provider onboarding training for our enhanced care management providers. Thank you all for joining again today. So our agenda for today, we're going to review our new HPSM CalAIM website. We'll talk about the prior authorization process and provide an overview of that, including what prior authorization is, the prior authorization form, medical necessity criteria, notification letters related to the prior authorization process, and then member eligibility. Okay, so the first thing we wanted to share are some updates to our website. We now do have a CalAIM portion of our website, which contains information specific to the CalAIM program, including enhanced care management. So we do encourage you all to visit this section of our website. It's a good place to go for updates and detailed information about the authorization process, a list of our CalAIM providers, as well as information on eligibility for these services for our members. And there is a link here that will take you directly to that section of our website. So we do encourage you to visit that site and check it out. Oops. Oh, yeah. All right, so I'm already going to hand it over to my colleague, Courtney. And hang on, Courtney, let me make sure you're unmuted. Can you? Okay, yes.
Can you hear me?
You can speak, yes.
Thank you, Molly. So, hi everyone. I'm Courtney Sage. I am, I'm the Director of Behavioral Health now. I have a new title in the last several days, but I have been involved in kind of the planning process for this authorization process. And so I'm supporting this presentation today, but did want to clarify that, I'm not going to be your primary point of contact. And there'll be some guidance at the end for some of those, and you should already have some folks, but I am going to help with this presentation today. So wanted to just give you this overview of what is prior authorization. Some of you may have familiarity, some of you it may be brand new. I know there were a lot of questions at the last training. So this diagram kind of has two starting points. Kind of the leftmost upper left corner is not always going to be where ECM providers start. That is an option if you do have a member that wants to initiate ECM services and you're in contact with them. This might be where you start, but I think in most cases, you have an existing ECM auth. Look at that top middle box, an ECM auth with an end date approaching, and a member still needs services. So want you to kind of orient to those two different start points. We want you to be aware of both because the end result is that a prior auth request, if it's authorized, it will land with an ECM provider. So all of these requests should occur in coordination with interested members. And so shifting to kind of that second top middle box, the provider or HPSM's ICM team will submit a prior authorization request. That is kind of the key of what we're going to be talking about today, is making that request. We have 2 guidance documents that we want you to be aware of. We do have our provider list on that last slide Molly showed. It said there was a spot where it said link coming soon. That is live now. If you were to go to the website, there is a document there that lists all of the ECM and CS providers, though today is really focused on ECM. We also want you to be aware that there is a very specific form that needs to be used for prior authorization. And I'm going to pause for 1 second, jump back 1 step. Using our CalAIM website is also a resource for just knowing eligibility criteria. We have some information there. Oh, thank you, Molly. So where it says link coming soon, that is live now. It actually has a link there now. You can go back. Thank you. Okay. So, and again, I'm doing a quick overview and then we're going to go in detail. So once this prior authorization request form is sent in, it arrives at HPSM. Our utilization management team reviews the request and makes a determination. Routine requests take 5 days, urgent requests, which means that it's like very urgent that somebody get the services right away. We would assume those would be quite uncommon, though, you know, it can vary. And again, I'm really speaking about ECM services. So it gives you some timelines on how long it takes for the decision typically. Once there is a decision made, there is a letter that gets faxed to the member, the ECM provider listed on the form, and anyone else listed on the form. Once your teams receive those letters with authorization, you would confirm eligibility, including looking at the auth start date, and then outreach the member. So this is just kind of a quick overview. It's okay if a little bit of it is confusing. Our goal for today, I think as Molly mentioned, is to give you some of the tools that you can come back to and reference when you do fill out your when you do go through the first prior auth process. I saw a question pop up about appeals. Yes, if there is a denial letter, it always has appeals rights within it, and there will be information in there about how to follow the appeals process. So yes, I think I'm ready for the next slide. So what is a prior authorization? So some services that you provide to members require prior authorization before providing the service. This is a process through which HPSM verifies that a service is medically necessary before you are authorized to provide the service. For ECM services, another provider or care manager may submit a prior authorization request that lists one of your agencies as the provider. So you might get an authorization notification letter for a member that you did not directly request services for. I feel like this is an important kind of back to that, thinking about that last slide, there's the kind of those 2 starting points. One could be an ECM provider renewing an auth, kind of sending in a new request for authorization for additional services, or an existing care manager or provider along with a member submitting a new request for new services. Thanks, Molly. All right, next slide. So, oh, this had some little pop-ups. So this is a tiny screenshot of our prior authorization form. We do have the link there for you. You can find it on our website. These are a few kind of top tips about making sure this gets filled out well. And want to point out that, you know, the intake process of this form is automated. We have an automated process that speeds up our response time and lets us handle a large quantity of authorization requests. So this means that we really have to ask you to be very thoughtful in some of the details. So we have a bulleted list on the side here. One is that you don't use a cover sheet. Additionally, it's really important that you're always using the most current version of the form. It is really important that you use the document using the fillable PDF version. It has to be typed. If you do it handwritten, it's gonna delay your request, and it may not even go through. It's really important that you attach documents that will help demonstrate medical necessity, and we'll talk about that in just a little bit. It's really important that information is accurate. Correct diagnosis codes, CPT codes, correct dates of service, start and end date. And we make a note here that ECM auth is typically 1 year. Let's see, important that you get all the member and provider information accurate, right? Their correct member ID, their correct date of birth, spelling of their name, all of those things are very important, so that we connect all the right members to the right services. We can only do one patient per form. You can't put multiple members on one form, and only one form per fax. So if you have to send in 5 in one day, you have to send 5 separate faxes. Wanted to clarify that we do think that most ECM requests will be routine, but if it is marked as urgent, it means that you're indicating that they need that service. They medically require that service within 3 business days, and so we'll process it urgently. So we're asking you to just use that thoughtfully. And then I'm seeing a question, assuming that for ECM diagnosis would be SDOH. Assuming that the ECM diagnosis, yes, you would want to use I'm going to go into that in just a little bit, Lucinda. It's a good question. Let me get to the next slide, and I think it'll address your question. So, wanted to bring your attention. Oh, wait.
I realized, Courtney, do you want me to skip ahead to the next one or focus on correction?
Oh, no. Yeah, we'll just keep moving along. This is perfect. Yeah, so on occasion, you might fill out the form wrong, or there might be something that needs to be fixed. Just want you to be aware that we do have a correction form that you may be prompted to use if something is incorrect. But specific in order for a decision to be made, sometimes if something is not included, it can result in a denial. So on occasion, we may ask for a correction if we can see that there is just an error. But we want you to be aware that this form exists. Excuse me. So also, if you submit a request for a service or provider, I think it's going to be maybe uncommon that you would request ECM services for a different ECM provider to provide them. But on the chance that you did, and that provider didn't have availability, we may prompt you to consider using a correction form so that we can get it changed to an available provider or correct service dates if that provider didn't have any more openings. So just, we're hoping this will be minimal, but it's helpful to know that it exists. So for ECM services, we have tried to simplify this. There's a number of codes involved in the claims process, but when requesting prior authorization to be able to provide the suite of ECM services, you can just use the code ECM00. So that's all you would need to put. That is the code that you would need to put on the form. Excuse me. And please, be aware that additional codes will be needed for the claims process. And so each of you should be working with your points of contact around continued guidance on the claims process. Okay, so medical necessity criteria. Lucinda, this is going to speak to your question a little bit. So when you do make a request for prior authorization, you need to provide enough information that indicates the member meets the criteria for the service being requested. And so that would include diagnosis codes, and for ECM, right, would be for that specific population of focus. It could be a mental health or substance use diagnosis, a chronic condition diagnosis, codes for housing or other social issues. So yes, Lucinda, hopefully that clarifies. You would want to use those codes that are indicated for those members. We also want you to include attachments on that prior auth form that describe the member's status relative to their population of focus. So you can include things like case notes, right? If you've had a contact with that person. And again, I'm kind of thinking that these are people who need a request for an additional authorization on top of the work you've already done. that you could include a case note, right? You've made a contact with them a couple weeks ago, and you can attach a copy of that indicating a discussion you've had about an ED visit and helping us understand that there were avoidable factors. Case notes noting complex social factors, if housing is part of it, and eviction notice, just anything that will help the utilization team understand that they meet these criteria. We're not asking for a novel, right? We're hoping that you can kind of include these things thoughtfully, and that's why we feel like adding a case note might be just the thing that would help us understand they continue to have needs. It's important to know that we're using the eligibility criteria listed below that DHCS has provided. They have an all plan letter 21012 and an APL attachment that actually has all the criteria for the populations of focus listed. We have these links on our CalAIM website that you can take a look at, and hope that before you do your first prior auth that you'll take a look at those to just understand what you want to demonstrate. Oh, good question, Ricky. A care plan, that might be actually a perfect thing to include. That would actually probably lay out a lot of it. We try not to dictate exactly what you need to provide, because if you can demonstrate it, but I think that's actually a great suggestion, and maybe we should consider adding it to the slide for better guidance. So once the prior auth is reviewed, there will be a notification letter. So after you submit a prior auth, you will get an authorization approval or denial by fax. Please be sure and note the approval letter start and end date. This is the service window for services to be rendered and claims to be paid. So it's just really important that you keep an eye on what that date is, regardless of if you've submitted the auth or not. So those are important for the whole continuum of care that you're connecting all these pieces. So to request continued authorization of ECM services, the ECM provider will need to complete a prior authorization form. So this is what I've been talking about. So please be sure to please be sure to request the new authorization at least 1 day after the end date of the existing authorization. If they're overlapping, it can cause some issues. Oh yes, so Lucinda, this is a perfect time for this question. Let's talk about that at the end, but I hope that what I was able to clarify is that if there is an auth end date, you should have an auth end date that's at probably about June for those members. She's asking about people who are pre-auth for 6 months. You would, if they do continue to need services, this is exactly the process that you would need to follow to submit a request for authorization. This is exactly the process you'll need to follow. So a little more on notification letters. If you do submit a prior auth for ECM and receive a denial letter, we're asking that you please transition that member out of services by their auth end date. If you claim services outside of that authorization date, you will probably encounter some issues. Please be sure to follow best practices and contract for transitioning members out of case management. If you submit a prior auth for ECM and receive an approval letter, again, I'm going to say it again, review the start and end date. Services can begin on the auth start date. You're always going to want to check member eligibility and contact the member and proceed with next steps. And just one more thing, Lucinda, if you, maybe we can, if I said something that made you think that was the case, that wasn't needed, let's talk about that at the end. I want to make sure I understand. I can answer. Do you want me to answer Ricky's questions real quick?
If you want to, yeah. Sure.
Yeah, I feel like sometimes it's helpful to do it right in the, so I don't think there's a specific timeline, but you just need to make sure you submit there's accurate information that allows us to review medical necessity. And it's important that, and I'm sorry, I should have said Ricky's question out loud. Ricky's asking how early we can submit a prior auth request. I would think 90 days is a little too early because you need to be able to demonstrate that they still need the services. And if you're able to resolve it in 90 days, that's a little, it might be a little bit early, but it is valuable to submit it a little bit early in order to get the auth response before the end date. We can talk about it more at the end.
All right. Thank you, Courtney. So now I'm going to speak a little bit more about member eligibility. So just want to clarify, we use eligibility in several different contexts. One is eligibility for CalAIM services, but here what we are referring to is actually member eligibility as a covered active member under HPSM. So this could also be referred to as Medi-Cal eligibility. If the member is a Medi-Cal member, the state determines Medi-Cal eligibility and then transmits that information to HPSM. It is important for our providers to verify member eligibility. We recommend doing so prior to every date of service. The reason for that is that if a service is rendered and then it's discovered that the member is no longer active as a HPSM member, HPSM will likely not be able to reimburse claims for that date of service. So to ensure that our providers can be reimbursed for all the services they provide, we do recommend checking eligibility as frequently as possible when you're providing services. So after you receive that authorization approval, that would be the time we'd recommend checking eligibility. And when you receive that prior authorization letter, it's important to note that's not a confirmation of ongoing eligibility. So we do recommend, again, checking that on a regular basis, even once you've received that authorization approval. And how do you do that? There is an easy way to check member eligibility online. We recommend visiting this section of our website. You can sign up for our provider portal, which allows you to verify member eligibility at any time online. If for any reason our portal isn't working for you on a given day, there are a couple other ways you can check. You can also check through these phone numbers that are listed here. And if none of those are working, you can also give a call to our claims department directly, who can check that for you. We also do have a video I should mention here on our website that just reviews how to check that eligibility on our provider portal. So we recommend viewing that to learn how to check it online. Okay, and then here are just some important links and a reminder for the PA process. Here we have linked our CalAIM portion of our website, which we shared earlier. This includes our ECM provider list and authorization tips and the DHCS detailed eligibility criteria. We also have our prior authorization section of our website. That's where you can find our current prior authorization form, as well as a correction form if that is ever needed. And then here is that link to sign up for our provider portal where you can check member eligibility. And finally, we have linked here our provider manual. This is a section of our website that really includes information on all of the processes that might be relevant to our providers. So if you ever have a question you can't find the answer to elsewhere on our website, we do recommend checking there and seeing if you can find the information you need as well. All right, let me check our questions. All right. Okay, so this is just good reference information for when you have questions on an ongoing basis. we've shared a lot of information today. A lot of this information is new as this is a new program, so we just want to, normalize. There will be a learning process, but we are here to support you throughout this process. We have provided a good amount of information online and hope that's easy for you to reference. But if you have additional questions, you can also contact us directly. For questions about any of your claims or claims payment, you can reach our claims department. This information here. If you have questions about prior authorization status, you can reach our department at this phone number. If you have questions about credentialing, your contract, or rates, you can contact our provider services department, this email address. And for other programmatic questions or questions about issues that you're still having challenges with, you can contact our strategic partnerships team here. Okay. Yep. And with that, we just wanted to show this workflow one more time. This will just be a good reference point to check back on. And that concludes the information that we're sharing today. And so if you have any additional questions, please do feel free to add them in the meeting chat tool. And we will see if there's anything else we can answer. Let's see. I see.
Think so. Lisa has some comments, so I'll kind of leave those for a second. But Ricky, you had a question about someone opting out of Care Advantage, and will there be a gap before their Medi-Cal is assigned to HPSM? And this is like, I just want to clarify, it sounds like this is just a benefit eligibility question and not about ECM, no? I mean, I get it's about ECM because you're providing ECM, but I don't know if this interconnects with the authorization, maybe. Just trying to connect the dots.
And so in addition to the meeting chat tool, I did try to unmute everybody. My team's guidelines don't seem to be working today, but if anyone has, I don't know, Ricky, if you are able to respond, if you have any clarifications to questions.
This may be both Medi-Cal or authorization issue, because I think it's like when members opt out from Care Advantage, and then there is a gap period that is, the Medi-Cal go back to the state, and then the state have to reassign back to health plan. But I think that's what I'm asking. What's the recommendation? Because that is still within the authorization period. And then sometimes we get the information after. Because it's like the client still have Medi-Cal, but it's not with health plan. That's why that is part of the ECM questions too, because we'll continue to provide services when we check. But however, if we goes to Medi-Cal, it may not be designated to health plan yet, because it's still a state Medi-Cal now. That's why I'm asking for recommendations.
I think I understand what you're asking. You're basically saying, what is our process if we have an authorization, but the member is not an HPSM, the person is not an HPSM member for a period? And I think
that's correct, but it's still a Medi-Cal too.
Yeah, and so I think our current overall process is if someone isn't our member, we don't have a pathway to pay any claims for them. But I think I'm going to have us hold on to this question and get a deeper understanding and response back to you.
Yeah, and we can definitely do that. But generally, that is part of why we recommend really using that eligibility information on the provider portal as our source of truth. That is the same information that HPSM has. And so if for any reason a member loses their eligibility, whether it's because, they're having a temporary gap, they're moving counties, whatever that might be, if they're no longer eligible for HPSM, that will appear there on the portal. And so whatever the reason might be, if they're not eligible based on the portal, then the claim would not be payable from HPSM. All right, so hopefully that at least started to answer that question. Eligibility can be a complex issue, but we do always just recommend using that portal as the source of truth. And there's a question about sharing this PowerPoint. Yes, we will be sharing the slides and the recording from today with everybody. And so we do encourage you to share it with your teams, anyone who might be working on authorizations or checking eligibility. Okay. And I do see that it looks like Lucinda might have a hand up, but that might be from an earlier question. Okay. Oh, okay. Sorry, Lucinda, you're still unable to unmute. I did try to unmute everybody, but it doesn't seem to be working today. I'm having some technical difficulties. Sorry about that, everyone. Oh, concerned about Medi-Cal loss subsequent to the removal of.
Hello, this is Lucinda. I'm sorry, my Teams is not working and it's kicking me in and out.
Oh, sorry.
So I just rejoined. I'm not sure if I can ask a question now or should I wait?
Yes, yeah, go ahead. Go ahead, Lucinda. Are you unmuted?
Oh dear, now none of my devices appear to be working. So here's my question, and hopefully someone else can hear the response. I can't hear you, but I'm assuming you can hear me.
Yes, we
so
can.
when several when hundreds of clients came in under whole person care and had 6-month authorizations, we were under the impression that at the end of the 6 months we would have to do our own internal formal assessment and then submit that assessment for reauthorizations. What I'm understanding you to be saying now is that an assessment may be a part of that, but not necessarily, that you'd rather us follow the guidance on the pre-authorization form. And am I understanding that correctly?
Can you guys hear me? Hi, everyone. I'm Gail Carino. I'm the LTSS Integrated Services Manager. So happy to take this one because I think yes on following the guidance, but also if the member is that in that grandfathered in group of folks that had received a auto authorization for that first 6 months, so that's the January to June, it is needed that a prior, or not a prior auth, a reassessment is done or completed, within that first 6 months. and prior to submitting that prior authorization request, as I understand this as the folks that were already being serviced, if that's correct. Does that help? Or Lucinda?
Looks like Lucinda might be muted again. Oh, our audio is not collaborating with us today.
Gail. So just to, because, oh, and Lucinda left. Just to follow up with, are you able to hear me?
Yes.
Okay, just to follow up with Lucinda's question, and I know we have discussed this with Amy and Sophie. So we will submit reassessment. And do you need the care plan? I know Courtney said it would be helpful.
The care plan would be helpful to submit as well.
Okay, so the only thing is, I think we're looking at around 160, 180 on top of my head. Are we able to send it like in by batch? Or because it would be difficult to send 180, I mean, both ways anyway, for you to review 180 by June, or for us to send it all together by June.
Can I just recommend that we kind of take that in and say like, oh yes, that we hear you on that, and let's think about it.
Oh, sure.
But you know, this is a process that will have to be followed, and so it sounds like we'll have to give it a little more thought and have someone loop back about how to support you in managing it. But I will pose the question to consider is, will every single person still qualify for additional services? And will you be recommending that for all of them? Or will there be some that won't qualify any longer?
I think some, yeah. Some won't qualify, and we will reassess everyone. Like,
Roselle, I think you may have been cut off at the end. I'm not sure if you unmute.
yeah, I think Lucinda is back. You're muted, Lucinda.
Courtney, you're muted as well. Are you
I know,
able
I'm just expressing myself about wishing we could hear Lucinda. I wasn't saying anything of value.
Yeah, I'm not sure why that is. But if Teams isn't working for us right now, we can also continue conversation about these questions offline. So.
I did see a question about 21 plus. You know, that the definition on our website says 21 plus. It does, DHCS is defining adult as 21 and over, and so that's what we're going with.
All right, let's see. Yes, note from Janet that DHCS has determined the criteria.
Yeah, that's an important note. We're using their criteria for our decision making, and so you can see the APL link on our CalAIM website.
All right, are there any other questions for right now?
Hi, this is Jennifer. I had to step away for just a second. The only way to get pre-auth then is to fax. Is that accurate?
Yes. And some people use eFax, if there's a program that you can use your email and attach.
Attach it, yeah.
I'm going to stay out of eFax territory. I don't know. I don't have any guidance on how to do it, but I know some people do use it.
Yes, Janet confirmed that as well. Thank you, Janet. All right. Well, I think if we don't have any other questions right now, once again, we will share this presentation out to everybody. If you have additional questions, please, review the section of the website that we referenced, and then feel free to ask us any additional questions you might have. Courtney or Gail, anything else you'd like to add?
Just thanks for taking the time, and we really appreciate all the work that you guys are all doing. It's a lot of shifts and changes, and we're trying to get you the information you need to be able to do this pretty smoothly. And the first few forms, you might have there might be a little learning curve, but we're hopeful that the guidance we gave you today should keep you on the right path.
Thank you, Courtney, Molly, Gail. Thank you. That was really helpful.
Thank you, guys.
Thank you all. All right. Thanks.
Take care, everybody.
Bye.